So our team studies inborn errors of immunity. These are actually rare diseases that present very early on in life, and that's because you're born with a genetic change or a genetic defect which disrupts the way your immune system works. We are really trying to understand the genetic cause of these conditions and trying to implement a research model and a pipeline whereby we can increase the diagnosis of these conditions to about 70% in the next couple of years. There's about 500 different known genetic causes of inborn errors of immunity. So while we consider them to be rare disease, there's actually just a lot of them. So when you put them all together, they're not that rare. So they affect about 1 in 1,000, 1 in 5,000 individuals. Currently, these conditions are being diagnosed through the advent and the access to technologies such as whole genome sequencing. That has improved the diagnosis and it's expedited diagnosis in some cases. So currently about 35% of individuals who undergo next generation sequencing are getting a diagnosis. While that is an improvement on previous, it still means that 65% of affected individuals are not actually getting that diagnosis. And that's a huge gap, that's a huge unmet need. And that's really what our MRFF program is aimed at doing. It is increasing the diagnosis rate so that many more affected individuals and families across Australia will have expedited genetic diagnosis for these rare diseases. And that will then allow them to hopefully have better access to more appropriate and more targeted therapies, which of course will just result in better outcomes and better quality of life for these individuals.